Today, I'm going to introduce you Dr. Multifamily Syndicator. He'll share the rest of the info. Dr. Kinjal, please introduce yourself, give your background, and kind of, not only what you do currently, but what you're, hoping to do in the future, and what else you want to share. So, about your history.
Thank you, Mr. Raju. Thank you so much for the opportunity to begin with. And I really hope that the listeners can, take something from our discussion here that'll help them propel themselves in their life. And to begin with, I would like to start off very humbly. I am a neurologist, a physician by my main profession, if I may. And like I say, I spent 15 years trying to sharpen the axe, and I've already started chopping the trees. So now I'm trying to move on to sharpen a different axe, which we'll talk in a second here. But I'm a board certified neurologist and also a neurointensivist. And so I call myself a daytime physician and a nighttime investor, just to make it a little catchy. But essentially, I'm a physician. I've been in practice for the last 5 years. I trained in the United States. I did my residency in neurology in Mississippi, and then I did my fellowship in Baylor College of Medicine in Houston. And then I've been in practice for the last 5 years. The initial part of that was as a stroke medical director, and now with a large multi-specialty private group, CLS Health. So, the way I see it is I live 4 segments of my life, or I put my life into 4 different segments in terms of priority, family being number 1. Mostly my psychiatrist wife, who's very, very considerate in terms of my endeavors and the time I can allocate between these 4 different buckets that I try to live every day. And I have 2 little, kids, a 2-year-old and a 6-year-old. That also keep life busy with activities and their school education and things like that. And then I obviously have a real estate venture, which I just recently started more actively this year. Sort of, you may call it a midlife crisis, if I may. And in fact, I did turn 40, so it was right by the time. And I'll be actually 41 in 3 weeks. So this time last December, actually, I was at the juncture where do we go from here? I'm done with sharpening my axe. Now I need to sharpen a new axe. And so talked to a lot of friends and some very, very good advices, the pros and cons of what I could do from that point onwards. And I think real estate, came at the top for numerous reasons. Generating wealth, being tax friendly investment, being diversification of investment, and also something that's just different from what I've been done for most of my life. So basically, I was looking for something different, and then something that can give me an additional sense of purpose, if I may, for the rest, whatever decades I have on this planet. So I started actually real estate. I started something about 3 years ago as passive investor, and then this year, after joining a coaching program with Jake and Gino, I was able to sort of propel myself with a lot of other mentors in the program, the coaching program, and kind of go into syndications on the multifamily side, which is sort of my buy right, if I may. So that's sort of my real estate bucket. And obviously I have the clinical work where I do my private practice work. And I kind of mix that up as well. I do a little bit of ICU work. I do a little bit of clinical work in the hospital side. It's kind of keep it mentally challenging, if I may, and not make it dull, if I may. And then the last bucket, which actually just fell in my lap, is clinical research. Now, I do have an extensive research background with neurosurgical clinical trials before starting my formal training in neurology. And so that was one sector of my life I thought I had lost completely touch with. Until this opportunity came to me to be sort of act as a site expert and sort of a subject matter expert in some of the clinical trials they were doing on acute ischemic stroke. So that is something is still in the works. Hopefully we'll start January of 2023. So this is sort of in a synapse, the type of life I try to live on a day-to-day basis. So
awesome. Well, yeah. obviously, there's as you can hear, he's got a lot of stuff going on, but he still finds time which I'll jump into the next question, which kind of relevant to the next question, is he still finds time to connect with people, work or network with people, not in real estate, at least in real estate. That's what I'm familiar with. That's what I've connected with him. With that being said, so doctor, kind of share who would you like to connect with and who can you help?
Absolutely, absolutely. And I love this question. I just love this question at so many levels. I've always been a proponent of helping the ones that are in need. And I'll give a little background story of myself back home, which is India. Um, there were times in my life where I was given such negative environment where outside my family, of course, where there were statements that, because of our financial status, I would never be able to make it out of here. I would not be able to get visa. And so, those challenges kept piling up, but I just kind of went straight in, head forward, never look back. And here we are. But the goal is to not only uh, take the negative out of those challenges, but to propel the positive forward. So I think what I want to do is help others out with whatever positives I've learned through all the challenges that I've been through in the last 15, 20 years, since I passed my 18, because that's when I kind of, got the real stuff. And then, help them grow and also, grow with them and grow their net worth. And so I think going back to the networking part, I as you said, it's such a funny thing that it's hard to network separately, if I may. So I can't really network in the hospital and say, oh, this is just my clinical networking and not a real estate networking. It all just comes one when you just love something so much. Topics come forward and you kind of put a little point across, and somebody who is naive is going to ask you questions. And so I think the financial literacy of all these different ventures is sort of my sole goal, and sort of providing education. I think that's what I take it as number one. I think profits and losses are there. They will always be there. But the academia, or the providing knowledge, the spreading of knowledge, and I sincerely believe in what they call as free open access medicine. Well, it's a word for medicine, but I call it free open access, which means it's just a free thing where you don't. And there are people actually on LinkedIn that have reached out to me. I'm not gonna put any names, but hey, if you want to train this medical student or this potential student, we may offer you X amount or Y amount. And I said, just send them here. I am not going to charge for an education when that is what I should be doing as a humanitarian or as a physician or as a real estate investor, no matter what bucket I'm living in. And so I think if you put your heart before your head, when you take up these ventures, I think it takes you longer, but you get there with the full satisfaction of the journey, if I may. So yeah.
Awesome. That's a lot in there. That's an awesome, yeah. And I can attest, like, having talked to Dr. Kinjal and I've been introduced to him to other people, you know, reach out to him. I would say, whether you're in real estate or whatever venture you think works well with him to network. So reach out to him. Great networking for the future. Connect with him. Is always ready to respond. Pretty quick to respond, by the way. With all the stuff he shared, he's very quick to respond. So that's what's amazing about him. Anyway, going beyond that, now, already kind of based on what you shared about who you like to connect with, there's already an inspiration there. But I'll ask you anyway, what inspires you to get up and do what you do every day?
Yeah, that's I knew that was coming up, but so I personally think of myself, and again, I'm still learning myself. I know I've been on this planet for 40 years, but I'm still learning myself every single day. From what I know of myself, I just stay excited about things in life in general. So whether that be, I'll use some very common things like changing a diaper, or going to a grocery store, or taking care of a patient, or looking at a real estate deal, all these different things, taking kids to soccer practice. If you don't have that positive sense of feeling before you embark on each of these activity, um, I don't think they became sustainable. And in the sense you get tired at some point, and tired in the sense, especially on the physician side of life, you get the burnout.
Mm,
And as we know, COVID has burned out a lot of us, especially ER docs, family medicine docs, ICU docs, and they started quitting. And by quitting, they have started to go into side gigs or side opportunities where they could find something different. And that's maybe where I was last year.
mm,
And so I think being excited, and being looking forward to things, whether that be a minuscule thing or saving somebody who has a significant head bleed, as long as you have those things in the back of your mind, it just keeps your day going well. And I'll put it very simply. So if good things happen, right, always be humble, be very humble, and be respectful. If bad things happen, learn from it, but focus on the weaknesses, the way I see it, so that if you encounter it next time, you can see the positives in it, and do something differently about it. And so something very nice that I learned from one of my mentors, who's a chairman of neurocritical care neurology at UTMB here, that when you find these challenging cases, or when you find these challenging conditions in patients where you may not be able to help them at the best of your ability, be very humble. Be very humble. The ego has absolutely no place there, because the moment the ego comes in, negatives come in, and you never intend to learn from that situation, because it's the learning, it's the pushing that boundary in those scenarios that'll help you if you ever encounter a similar or a different complex situation in the future. So I take that lesson to heart, and try to imbibe it on a daily basis. So yeah.
awesome. That was that was a lot of deep conversation there. Several deep conversations there. I could create an entire news, interview or podcast there, right there. But we'll do it another time. Maybe perhaps another month, another time.
Thank you.
Well,
Thank
with that being said, you already probably gave some tips right there in that
Right.
inspiration. You gave several tips, but I still will ask for one tip. So you only have to share one tip. What's the one tip, personal or professional, that you would like to share that
Absolutely.
helped you, will help others?
Absolutely. So, this was actually coming from back in the day when I was a research coordinator with neurosurgery in Jackson, Mississippi. We used to have this endowed professor of orthopedic surgery, and he, I did a lot of work for him. He was one of my mentors amongst other mentors in clinical research. And he used to always tell me that if you want to go far in life, remember 3 A's, letter A, or alphabet A's. And I
Mhm.
said, sir, what are they? And he would say, be able. So you have to be able. So you have to constantly stimulate yourself to be able to do things. Be
Mhm.
available, which is
Mhm.
why I try to respond whenever somebody reaches out to me as soon as I can, if possible.
Mhm.
And be affable.
Mm.
So able, available, and affable. If you're
Awesome.
able to do these 3 things on a continuum, on a daily basis, I think life has a bright sun and a sunflower to it, if I may put it that way. So
Oh, that's a great tip. That's one tip, new tip I never heard before. This is a pretty new one. 3 A's, triple A. All right,
triple A's,
awesome,
yes, yes,
awesome,
yes.
awesome tip, Dr. Kinjal. And thanks for taking the time. And I'll be sharing doctor's information, his
Please,
website, or whatever I have of him. So reach out to him. Like I said, I would say you would have a great conversation regardless. Whether
please
things were
text me, call me. I will not charge you a dime. Just say hi to
good.
me.
There you go. There you go. See, doctor that doesn't charge. Take that opportunity.
And if you want to show me your scans, albeit I will still not charge you a dime. No
Awesome,
worries.
doctor. Again, thanks for taking the time. I appreciate
Thank you.
your time.
Thank
And
you.
like
Thank
I
you.
said, I'll share the info. And yeah, like you can see,
Thank you.
again, I can't emphasize how fun it is to talk to and network to it. So I encourage you guys to reach out to him.
Thank
Thanks.
you, Mr. Raju. Really appreciate it. We'll connect soon. Thank you.
Thanks.
Thank you.